So I use the Da Vinci Xi robot, and I use it for a broad array of procedures, everything from cholecystectomy to colectomy, adrenalectomy, and hernias of all types.
For enlarged ovaries, cystic ovaries, we do it for endometriosis, pelvic pain.
And we use it primarily for cancer surgeries, but also for reconstructive surgeries. It's really a great tool to reach difficult areas in the body.
The robotics really gives us a unique opportunity to deal with issues that in the past would have required a much more extensive surgery. We can do it faster, more efficiently, and more safely for the patient.
The quality of care is improved with robotics. So that's both with the quality of the surgery, reduction in bleeding, and also patient outcomes and recovery to activity.
People get to go home that same day, and they often feel much better the second day. They don't even have pain. They wake up feeling very happy with the surgery. So I think from a patient perspective, this has completely changed our practice.
Do our surgical timeout, and then make small incisions and place the trocars. Once the trocars are positioned, then we wheel the robot in, target it, dock it, and then I step away from the patient table and work from the surgeon console.
I'm right next to the patient, I'm seeing what's going on. I look down into the console where I can see very closely through the robotic eye what's going on. But the minute I can turn my head, I'm looking at the patient and I can see exactly what's going on.
There are several benefits of using the Da Vinci robot. One is a high-definition, stable picture. The other is wristed articulation. You have the ability to get to difficult-to-reach places, work in tight spaces using a lot of precise movements. It also filters out any motion tremor, which makes for a very smooth operation.
The platform is really the dream of a general surgeon. With the Da Vinci, I actually am controlling 3 different instruments with my 2 hands. And they've designed instruments for every use. I think the devices we're using with the robotic platform are more precise than what I was using laparoscopically. It's just amazing what you can do. The fine touch is unbelievable.
Increased mobility within the instruments with up to 10-fold increased visualization with the cameras.
I had a gentleman that was 87 years old. We fixed bilateral hernias robotically as an outpatient, and he played in a pickleball tournament about 3 weeks after surgery. If I'd done those surgeries open, he would have been hunched over and barely walking for 6 weeks. The Da Vinci platform allows for all the different subspecialties to have access to this equipment that is life-changing, not only for the patients but for the surgeons.
Having access to that technology to be able to provide cutting-edge care for patients.